there, my name is Tiana Priestley. My full name is spelled T-I-A-N-A-P-R-I-E-S-T-L-Y. Today I am going to be performing a full head-to-toe assessment for my final evaluation for our health assessment class here at Seneca College. Before we begin this assessment, I'm going to do a 360 scan of the room, just to validate that the only people in this room are myself, my patient, and my videographer. Before getting started, I'm going to do three things. I'm first of all going to perform hand hygiene. I'm going to cleanse my stethoscope. I'm going to cleanse and sanitize all of my equipment. And I'm going to be putting on a fresh pair of gloves before I enter my patient's room. Now, upon entering my patient's room, I'm going to introduce myself. So, hi there, sir. My name is Tia. I'm a first-year nursing student here at Seneca College. Today, I'm going to be performing a full head-to-toe assessment. This assessment is going to require some touching. Can I confirm your consent that you feel okay with this?
I'm okay.
You're okay? Perfect. Thank you so much. Do you feel safe and comfortable in this space?
Yes.
Okay, wonderful. Do you mind just telling me again your name and date of birth before we start?
Will, January 1, 1970.
Excellent. And do you mind showing me your wristband just so I can confirm this one more time? Excellent. So the patient's name and date of birth aligns with what they have said. Before we start, do you need to use the restroom at all?
No.
No? Okay, thank you so much. Now I'm just going to close my curtain and I'm going to ensure patient privacy. Okay, now Will, before I start the physical examination at all, I'm just going to ask you a series of health history questions. Do you confirm your consent to this and you feel okay and comfortable?
Yes.
Okay, wonderful. So it's okay to ask these questions?
Yes.
Okay, excellent. Thank you. So can you describe to me what brought you into the clinic today?
I fell.
You fell? And when was the onset of the fall? When did this pain begin?
Began about a day ago.
It began about a day ago. And is there anything that makes the pain feel better or worse?
Yeah, getting some rest.
Getting some rest. Is it worse in the morning or worse at night?
Worse in the afternoon.
And does it radiate or is it localized?
Just on my wrist, particularly on my wrist.
Just particularly on your wrist? Okay. And on a scale of 1 to 10, can you tell me how you would rate the pain, 10 being the worst you've ever felt, 0
5.
being nothing, about a 5? Perfect. Thank you for answering that. And then again, the time of the fall, you said that took place about a day ago?
Yes.
And have you ever fallen before?
No.
No, this is your first time?
That's right.
You have no history of falls?
No.
Okay. Do you have any family history of medical concerns that I should be aware of, including
None.
like dementia? No? Have you ever experienced headaches or dizziness before?
None.
No? Okay. And are you on any medications or do you have any allergies? Anything that I should be aware of?
None.
None? And in terms of your at-home daily activities of daily living, do you struggle with anything? How would you find that your home life is?
I'm doing just fine.
You're doing just fine. Do you feel like you're eating enough in a day, drinking enough? Would you
I'm well nutrition.
Yeah, do you consider yourself to be dehydrated or anything like that?
I'm well hydrated.
You're well hydrated. Okay, perfect. Thank you so much for answering these questions for me. I am now going to begin my physical examination. Before I even begin to touch my patient or anything like that, I'm going to take a kind of like a visual examination of a couple things. I'm going to be looking at my patient's overall appearance and demeanor, so I can see that they are the age, gender, and ethnicity that they describe themselves to be. So we have a 92-year-old elderly male. They are dressed appropriate for the weather outside. I'm not observing any foul odors or anything like this upon my patient entering the room. In addition to that, I can see that the shoulders are well approximated. The patient is able to sit up erect and properly. The posture is appropriate for his frail age. He doesn't seem to be hunched over or anything like that. His weight and his height are normal and appropriate to his demographic. And in addition to this, I see that he is able to communicate with me effectively. He's able to respond to my questions. He is expressive, polite, and seemingly very willing to go on with the examination. So, Will, in addition to this, can I ask you to just take a short walk here and then please walk back? Excellent. So my patient's shoulders are in alignment with their feet. Did you feel any pain or discomfort upon walking?
No, just
No?
my wrist.
Just in your wrist? And the other thing that I'm noticing is my patient is not out of breath. Do you feel dizzy at all? Do
No.
you feel nauseous? No?
No.
You feel okay? Okay, wonderful. And then my very last question is, could you please once again tell me your name, the day of the week that it is, and where we are today?
Today is Monday.
Mhm.
My name is Will,
Mhm.
and we're at Seneca College.
Perfect. So again, I can see that my patient is alert and oriented ×3. Thank you so much for consenting to all of these questions. I'm now going to begin the physical part of the examination. One more time, can I consent that you're comfortable and okay with this?
Yes.
Okay, perfect. So I'm going to start by palpating my patient's head, palpating and examining. So I am looking for even distribution of the hair. I'm looking for any lesions, any bumps, any lumps, any bleeding. I'm looking for any infestation in the hair, even color, tone, distribution. Everything's looking well and normal. So I'm going to move on right now to the face. So I'm looking at the symmetry of the face, and again, I'm looking at even hair distribution in terms of the eyebrows. I'm looking at even skin tone. I'm looking to see if there's any moles or acne or discoloration of any kind, any swelling or sagging of the skin, but everything seems to be looking appropriate for the patient's age and background that he is describing. I'm just going to palpate, if that's okay.
Yep.
Perfect, thank you. Do you feel any tenderness or pain
No.
upon palpation of the face?
No.
No? Okay, excellent. So now I am going to be moving on to the eyes. So the first thing that I'm going to do is inspect the eyes. I see that they are symmetrical. I see that there's even hair distribution of the eyelashes and the eyebrows. The pupils, they look to be about a 2 in terms of my scale. I don't see any discoloration, any wateriness, any dryness, any crusting. The sclera looks clear and proper. I'm just gonna pull your eyes down here. So I'm looking for the pink color tone in the conjunctiva. So there's no abnormal findings at this time, so I'm going to proceed with my assessment. I'm going to do a couple tests here to test cranial nerve number 3 and cranial nerve number 2. Cranial nerve number 3, the ocular motor nerve, and cranial number 2, the optic nerve. So to begin here, I am just going to do what's called the consensual light reflex test. So I'm just going to turn my light on here. And I'm just checking to see that the pupils on each side constrict at the same time. The next thing that I'm going to do is my accommodation test. So if you can just follow the pen light. Perfect, so the eyes accommodate appropriately. And next I'm going to do what's called the cardinal gaze test. So can you follow my pen just with your eyes, please, Will? 1, 2, so I do 3 on each side. 1, 2, 3, excellent. So now I'm going to move on because cranial nerve number 3 seems to be intact. I'm going to move on and perform the Snellen eye chart test. So if you don't mind holding this out arm's length and just telling me what you read on the bottom.
2.
2? Perfect. So we can see, based on the Snellen eye chart, that our patient has 20/20 vision. And next, I'm just going to continue to check the reflexes of the eye. So if you can just tell me when you see the pen. So,
Yeah.
Sorry, if you don't mind following my lead here, and we're going to cover this eye, and then tell me when you see the pen.
Yep.
And then when you see the pen.
Yep.
And then again.
Yep.
Perfect. And then we're going to cover the other side.
Yep.
And
Yep. Yes. Yep.
Perfect. Okay, wonderful. So now we can see that cranial nerve number 2, the optic nerve, is well and intact. So now, moving on, we are going to be taking a look at the ears. So I'm checking to make sure upon inspection that each ear is proportionate to the head, that there's no discoloration, there's no edema. I'm looking for any excess cerebrum, And I am also looking for any lumps or masses on the ear, any keloids. Everything seems to be fine and intact. I'm going to begin palpating the ears. Do you feel any tenderness or discomfort?
No.
No? And on the other side, again, I am palpating the meatus and the tragus. Do you feel any tenderness or discomfort?
No.
No? Okay, perfect. So now I am going to proceed with my ophthalmic examination. So in order to do this, I'm just going to pull back the pinna of the ear, and I'm going to take a look inside. Perfect. So I can see the external auditory canal looks well and intact. There's no occlusion, bumps, masses, lesions, bleeding, excess cerebrum, and the perfect. Thank you so much. And the tympanic membrane looks and appears to be pearly white in color on both sides on both ears, so bilaterally. Okay. Next, I'm going to perform the Weber's test. So I'm just going to hit the bell. And can you tell me if you feel vibrations on both sides of your ears?
Yes.
Yes? Okay, perfect. Thank you. And then I'm going to perform what's called the Rhines test. So again, we're going to do the same thing. Tapping the back of each ear. Tell me when you stop hearing the sound.
Yep.
Perfect. And let me again know when you stop hearing the sound.
Yep.
Okay, perfect. Thank you so much. So upon assessment of the ears, we're going to proceed because we can see that the ears are well and intact. The next thing that we are going to begin to examine would be the nose. Perfect, thank you so much for removing your mask. So I'm just seeing that the nose is perfectly aligned to the midline of the face. There's no swelling, masses, lesions, redness, edema. There's no discharge coming out of the nose. And so the next thing that I'm going to do is be testing, I'm going to be testing the cranial nerve number 1, the olfactory nerve, and I'm going to be doing the patency test, and I'm also going to be doing the smell test. So do you mind just closing one nostril and blowing out? Thank you. And then doing the same to the other side. Perfect. Thank you. And then I'm just going to get you to smell. And what do you smell?
Double coffee.
A double coffee. Perfect. On the other side. What do you smell?
Coffee.
Coffee again. Okay, excellent. Perfect. Thank you so much. And then again, I'm just going to palpate the sinuses. Please let me know if you feel any tenderness or discomfort.
Nope.
No?
No.
No? Okay, wonderful. So the nose is well and intact, and the olfactory nerve, cranial nerve number 1, also appears to be well and intact. I'm now going to move on to examining the mouth. So upon examination, I can see that the lips are pink and well hydrated. If you don't mind smiling for me, I'm going to take a look at the gums. There's no bleeding, lesions, anything that seems concerning at this time. The teeth are nice and intact, and they're white in color. There's no discoloration that I can see. Do you mind opening your mouth again? I'm just going to examine the tongue. Perfect. Thank you so much. So the tongue is pink and well hydrated. I'm going to just again check the soft palate, and I'm going to check the hard palate. Perfect. And I can see that our patient's tonsils are pink, hydrated, and we can see them. So now I am going to be testing cranial nerve number 9 and 10, the glossopharyngeal nerve, and the vagus nerve. So if you don't mind just saying ah to me. Ah. Perfect. I can see the uvula elevating. So thank you so much for doing that. The next thing that I'm going to test for The next thing that I'm going to test for is cranial nerve number 12. So if you don't mind moving your tongue left to right for me. Left to right, move your tongue. Perfect. And I'm going to ask you to say light, tight, dynamite.
Light, tight, dynamite.
Okay, perfect. So cranial nerve number 12 is intact and the mouth looks healthy and well. Thank you so much. Now, moving on, we are going to be examining the neck. So the first thing that I'm going to do is take a look to see the skin tone, if there's any discoloration. I'm looking for any lumps, swelling. I'm looking for the alignment of the esophagus. I want to see if the thyroid or any other glands seem to be like puffy and swollen. Everything seems fine. I'm just going to touch your neck if that's okay. I'm examining bilaterally and everything seems normal. There's no swelling. There's nothing that I'm personally concerned of at this time. The next thing that I'm going to do is check both of the carotid arteries bilaterally. Perfect. So he actually has a very strong carotid artery on both sides. So bilaterally, the pulse is strong, it's even, the rhythm is good, and the grade is about +2. So moving on, I am going to be checking cranial nerve number 10, I believe it is, but it's the spinal process nerve. So in order to do that, I'm just going to ask you to lean your head against the resistance of my hand. Perfect. And then resist the other way. Perfect. And then I'm going to ask you to shrug your shoulders. Perfect. Against the resistance of my hand. So we can see that the spinal nerve is well and intact. Moving onwards, we are going to be taking a look at the upper extremities. So the first thing that I'm going to do is palpate and inspect. So I'm looking to see if there's any muscular atrophy. And our patient looks like they are healthy, muscular. There's no lesions, scarring, bumps, discoloration, anything that I'm concerned of in terms of like the skin at this time. It's warm to touch. There's no edema. There's no swelling. There's no diaphoresis or like any excess sweating. So everything in terms of my inspection and palpation seems normal and appropriate at this time. I am now going to move on and check the range of motion for my patient. So if you don't mind flexing and extending your fingers and flexing and extending your wrists. Now we are going to do ulnar and radial deviation with the wrists. Thank you. We are going to flex and extend the elbows. Perfect. And we are going to flex and extend the elbows. And then we are going to rotate internally and externally. And we are also going to do pronation and supination. Perfect. And then moving on to the full shoulder muscles, we are going to perform abduction and adduction. Perfect. And if you don't mind shrugging the shoulders also with me. Okay, wonderful. And then one more time, we're going to internally and externally rotate the shoulders, just as so. Okay, perfect. Thank you so much. Now I'm going to go on to examine the nails. So I'm looking at the nail beds. I'm making sure that there's no discoloration, that the nails are curved. So I want to make sure that there's no clubbing in the nails because that would show signs of malnutrition. And I'm also going to check the capillary refill of my patient to see how their blood flow is. So the capillary refill is under 2 seconds, which is a normal finding. So based on the nails, we can see that the patient is healthy, that they have good blood circulation. And now that we've completely examined the upper extremities, we are going to move on to the lower extremities. So I'm just going to take a look here and observe each of the lower extremities. So I can see that my patient has no muscular atrophy. Everything seems to be proportional bilaterally. They have appropriate muscle contour. There's no decrepitation. There is no diaphoresis, excess sweating. The skin is warm to the touch. There's no edema, excess swelling, anything of that nature. So I'm now going to move on to the feet. If that's okay, I'm going to ask my patient to remove their shoes very quickly, as I am going to be checking the dorsalis pedis pulse at the front of the foot. And then I'm also going to be checking the posterior tibial pulse of the foot. I'm going to do it on this side as well, just to make sure that I do everything bilaterally. Perfect, thank you so much. Excellent, and then again, the back of the foot, the posterior. Okay, excellent. And then I'm also going to ask you to flex and extend both feet. So if you can push up, perfect, and then push down. Excellent, fantastic, thank you so much. Excellent, so now I fully examined the lower extremities. There are no abnormal findings at this time. Next, I'm going to perform hand hygiene after touching my patient's feet. And we are going to move on to the posterior thorax part of the assessment. So after my patient puts their shoes back on, I am just going to ask them to turn around with their back facing me. Thank you so much. Thank you. So for this part of the assessment, I'm going to first start with inspection. So I see that the skin is even toned, distributed. There's no signs here of crepidation or spinal misalignment. There's nothing seemingly concerning at this time. I'm going to palpate the skin. It is warm to the touch. There is nothing particularly alarming or concerning for me at this time, so I'm going to proceed with my next step, which is called percussion. So we're going to start here. And we're just looking for those dull, hollow, low tympanic sounds to indicate that there's no occlusion or buildup of fluid in the lungs. So moving on from that, I am going to test and look at the patient's anterior, posterior, the APT ratio. And we can see that it is a 2-to-1 ratio, which is very normal, and it's good to see that. The next thing that I am going to be performing, the next examination that I'm going to be performing is called the the tactile formitas. It took me a minute to remember that, but it's called the tactile formitas. So what we're going to be doing is testing the vibration of the patient's lungs. So I'm just going to ask you to repeatedly say 99 on my command. So please say 99.
99.
99.
99. 99. 99. 99.
Perfect. Thank you so much. The next thing that I'm going to test for is the symmetrical expansion of the lungs. So I'm just going to pinch here and then ask my patient to breathe in and breathe out. Excellent. So I can see that the lungs are well approximated here. And then moving on, I am going to be auscultating. Let's breathe in. Thank you. And again. And again. And again. Perfect. So I'm just checking for any crackles, wheezing, abnormalities, but I don't seem to be hearing any fluid in the lungs right now, or any sounds that are concerning to me of this time. The breathing is regular, it's a proper rhythm, proper rate, and for now that concludes the That concludes the assessment of the posterior thorax. I'm now going to move on to my chest assessment. I'm just going to get my patient to turn around here. So I'm going to take a breather. And I'm going to move on to my anterior. And I'm going to start my cardiac assessment. So in order to do this, I am going to be auscultating the various valves of the heart. Okay, perfect. So I'm going to be auscultating the various valves of the heart. There's no abnormalities or any discoloration or anything that I see at this time. So we're going to start here with the aortic valve, and then we're going to go on to the pulmonary valve, and then we're going to move downwards towards the tricuspid and the mitral valve. So before I begin this assessment, I want to explain that the aortic and the pulmonic, these two valves are found in the second intercostal space, and then moving downwards, the tricuspid is often found in the fourth intercostal space, and then the mitral valve, the mitral valve is found in the fifth intercostal space. Additionally, the S2 sounds are most predominantly heard in the aortic and pulmonic valve, and then the S1 sounds are most predominantly heard in the tricuspid and the mitral valves. So I'm just going to be listening. And again. And again. Perfect. And I also want to be checking for the herbs valve, which is in the third intercostal space. So, moving on, we are going to be examining the abdomen. Yeah, we're going to be examining the abdomen. So I'm going to get my patient to lie down flat on our examination table here. Perfect. Thank you so much. So I want to ensure patient privacy. I'm going to cover the bottom of their abdomen with this like little drape here, and then I'm going to pull this up. We would have the stomach exposed, and then I am going to start with auscultation of the stomach. So I'm going to be auscultating in all four quadrants. So the first thing that I'm doing as I go down the stomach is I'm going to be auscultating for bowel sounds. So I want to hear kind of like this gurgling, like bubbling sound would be normal. If there's an absence of bowel sounds for more than 5 minutes, then that's going to be like very concerning for our patient, but luckily we're not finding any indication of that. And then the second form of auscultation that I'm going to be doing is to check for any vascular sounds. We're going to be looking for any signs and symptoms of what are called bruits. And I'm not seeming to hear any of that at this time. So we want to be checking the iliac space, the renal space, pulmonic, and the femoral. Based on auscultation, everything looks fine and well at this time. Now I'm going to move on to percussion. So again, we want to be hearing those dull tympanic sounds as we percuss the stomach. Perfect. And then finally, I'm going to move on to palpation. So I'm just going to be feeling. Do you feel any pain or discomfort?
No.
No? Okay, wonderful. And the last two tests that I'm going to do are called the Bloomberg's test and the Murphy's test. So Murphy's test is just underneath the rib cage here. Do you feel any pain or discomfort?
No.
No? Perfect. And then the Bloomberg's test, I'm going to push down and release. Do you feel any pain or discomfort upon me doing this?
No.
No? Okay, perfect. So the patient's abdomen seems well and intact. You can sit off. Perfect. to be testing, we are going to be doing a sensory test, we are going to be doing a reflex test, and then lastly, we are going to be doing a balance test. So I'm going to start here with a series of objects to test my patient's sensations. If you don't mind closing your eyes and holding out your arm. The first thing, can you tell me what you feel?
Something rubbing.
Something rubbing. Does it feel soft, hard?
Soft.
Perfect. Can you describe the object potentially? Soft like a...
Soft like a cotton.
Like a cotton ball. Perfect. And then now I'm going to go on. Can you please tell me if you feel a dull pain or a sharp pain? You feel dull or sharp?
Dull.
Perfect. Now do you feel dull or sharp?
Dull.
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 Okay, perfect. So the patient can identify. The next test is called the stereognosis test. So I'm going to place an object in my patient's hand, in their palm. I'm going to ask them to identify what that object is. What do you think that this is?
25 cents.
25 cents. Perfect. You can drop it in my hand. Thank you so much. Excellent. And yeah. Oh, and the very last test that we are going to do is I'm going to ask my patient, I'm going to move a portion of my patient's body and then ask them to identify the location. So, can you please tell me what part of the body I'm moving?
My fingertip.
And where am I pointing it towards?
Towards me.
Towards you. Perfect. So I can see that my patient's senses are well and intact. Now I am going to be moving on to, the senses are intact. Now I am going to be doing, I'm going to go for my lifeline here and take a look at my paper. Sensations. Oh, I'm going to be doing my reflex test. Okay. So I'm going to be doing my reflex test. I'm going to start with the brachial reflex. And then I'm going to do the triceps. The brachial radial reflex. And then I'm going to go downwards and do the top of the foot. I'm going to use my second lifeline here. Okay, so I'm going to be doing the patellar reflex, and then the Achilles, and then the Babinski's. Sorry. Okay, and then last I'm going to be doing my balance test.
Yeah.
So the first thing that I'm going to do is what's called the Romberg's test. I'm going to ask my patient to stand up directly, close their eyes, and I'm just going to make sure that they don't fall or swivel. Now you can open your eyes. Can you please just walk towards me normally? Can you please walk back on your tippy toes? Can you please walk towards me on your heels? Perfect. And then stop. And then I'm going to ask you to close your eyes again and put your arms out. Perfect. And I'm going to see if this is the pronation test to see if the arms fall. And they do not. They are well. My patient is able to balance. You can put your arms down. And that's going to conclude my assessment today.